President Obama is naming an Ebola czar. He's open to implementing a travel ban, and officials are already checking travelers' temperatures at a handful of airports. All these moves are a response to a growing wave of criticism over how the U.S. government is handling Ebola. But it didn't always used to be like this. Americans actually used to trust public health officials. So why don't they believe authorities can handle the latest crisis? For more on this, we're joined by David Oshinsky. He's a history professor at New York University and the director of the Division of Medical Humanities at the NYU School of Medicine. David, thanks very much for being here.
My pleasure.
As we were just talking about, one of the biggest areas of disagreement right now is this idea of a travel ban. The majority of the American public thinks it's time. Most public health officials are saying they think it's a bad idea. Why do we suddenly see this gap where the American public just doesn't trust medical officials?
Well, I think this goes back many years. We live in a kind of post-Vietnam, post-Watergate, web-obsessed culture where we over the years have really begun to believe public officials and experts a lot less. The suspicion really has been growing. And I think with Ebola, the gap has widened. And the reason is you see the public opinion polls now. The vast majority of Americans support a travel ban. The vast majority of public health officials don't. And you really don't want to put it into something where one side is right and one side is wrong. And there's been a lot of talk that to be opposed to this travel ban means that you're racist or xenophobic or just not up on the issues. And that is not true. The American people strongly support the idea of sending aid to Liberia, sending soldiers, sending supplies, sending doctors and nurses. And that's where the battleground really is. What they're really worried about is that we don't at the moment have in place any kind of system to really prevent Ebola patients from that area from coming in. And the CDC and other organizations have really been behind the curve, and they haven't in any way helped public opinion that way.
Yeah, they certainly haven't given people a lot of reason to trust them. But I feel like now it's almost a natural reaction for our generation to be skeptical of what officials are telling you, even health officials. But it didn't always used to be this way. You wrote a Pulitzer Prize-winning book about polio and about the response then. You're also well-versed in how health officials and the public responded to smallpox. How was that different from what we see now?
Well, there was a smallpox epidemic in New York City in 1947 where a guy very similarly gets off a bus from Mexico, has smallpox, goes to the hospital, he's misdiagnosed, it begins to spread. But the difference is that the city, in a voluntary but massive campaign, lined up 4 million people to be vaccinated. And no one, the lines were snaking everywhere. No one was sort of worried, is the vaccine dangerous? They were worried there might not be enough of it. In other words, they really had that kind of faith. And with polio, it was exactly the same way. I was a polio pioneer as a kid. My mother lined me up along with 2 million other school kids for a vaccine. No one knew whether it worked. No one knew whether it was going to be successful, whether it was safe. But my parents had, and that whole generation, also a sense of risk versus reward. In other words, they had seen year after year what a deadly infectious disease can do. Today, there is no polio in the United States. So people say, why should I get vaccinated? Why take the chance? I don't believe the experts. But what we have to understand is if you don't get vaccinated, polio is only a plane ride away. And I think with Ebola, there is really that sense over the years that there's been a breakdown of community. And there's been a breakdown of communications, I think, between public health experts and the public.
Now, David, I'm curious if anyone was watching these hearings we've had so far on Ebola. Clearly, even our congressmen are very skeptical of what public health officials are saying. Do you think this political grandstanding is a symptom of this mistrust, or do you think it's something that's making it even worse?
I think, in a way, it's a symptom of the mistrust. Ebola is something that, to be perfectly honest, the CDC was behind the curve, but it's understandable. Ebola had always been a disease with a very high mortality rate that was in small villages in Africa, and it was so deadly that it would go through these villages and the virus would burn itself out. Suddenly, it's come in very large numbers into urban areas like Monrovia, and we have a very different kind of Ebola. And I don't think anybody was ready for the kind of epidemic that has occurred in Africa. And there's been a spill over in the United States. Our hospitals aren't ready. What we really should do very, very quickly is to set up regional centers, like Bellevue Hospital in New York City is now a regional center. But you can't, I think you really got to train people, doctors, nurses, and they are worried. They are worried that they are not getting the training and they are vulnerable and at risk.
Well, hopefully we will see a better response going forward. David Oshinsky, your story is on WSJ.com right now. It is the Saturday essay. Thanks very much for joining us.
My pleasure. Thank you.